So, have you ever had one of those days when you see a person wearing a strange hat and you think, who's that lady in the hat? But then you get closer and you realize it's actually your good friend and you say, what are you doing in that hat? I didn't even recognize you. Well, that may be a clunky example, but the idea is that context matters. You see, we all wear a lot of hats, at least metaphorically speaking. Sometimes we're employees, sometimes we're parents, sometimes we're random strangers sweating away at the gym. And very few people ever see all of the hats that make up our lives, which normally isn't a big deal. But when you start talking about healthcare, especially when dealing with chronic disease, substance abuse, or mental health issues, these hats become a problem. That's because, in the medical system today, doctors usually only see one snapshot of a patient's life. In essence, they only see one hat. But beyond that, there's the entire complex web of a person's health. Everything from where they live, to the chemicals in their environment, to the educational and housing opportunities that shape their choices. And as we all know, it's this entire web that truly defines a person's quality of life. And that's why many clinicians are exploring new ways to engage with the overall picture, new ways of involving families and caregivers and community partners in a way that reaches beyond this one snapshot. For example, let's say a patient is suffering from asthma. If a doctor only interacts with one facet of a patient's life, this one here in the examining room, then the only real improvement tool is the prescription pad. But if the doctor has the ability to collaborate with a larger network, a network that includes community health workers, public health nurses, and family members, there are opportunities to tackle much more than just the symptoms. The network can take on things like insect infestations, exposure to tobacco, and inadequate housing, all of which trigger asthma attacks. And that has a much greater impact than just the prescription pad. Examples like this are popping up all over these days, and that's why stakeholders from across the world of healthcare are starting a larger conversation. A conversation about how all of us can find better ways to improve the health of the people we care about, no matter what hat they happen to be wearing.